If there is any lump, any swelling which does not go away, if it is bothering you, just seek a consult. That is all you have to do. So blood in stools, blood in urine, coughing blood, or postmenopausal bleeding, all of these can be signs of cancer. Change in voice, cough lasting for more than 3 weeks, unexplained weight loss, all of these also could be pointers of cancer. People being obese these days, again owing to the lifestyle and lack of activity, driving a lot of breast cancers, uterine cancers, and colon cancers, and many other esophagus. There are like 9 to 10 cancers. People still imagine radiation like it used to be like 20 years ago. Okay, like big machines, hair loss, burns, and you become radioactive in the end. Even till today, I still get questions only regarding this. More or less, the radiation treatment feels the same because it feels like nothing. You don't feel the radiation beams on you. Okay, you can't see it, you can't hear it, you can't feel it. It's like getting an X-ray.
Hello everyone, my name is Akash and welcome to another TAL Radio Health Talk. Today sitting with me is Dr. Apoorva Kulkarni, a consultant radiation oncologist at Continental Hospitals, Hyderabad. She's an MBBS gold medalist with over a decade of clinical experience dedicated to high precision treatment and holistic patient care. Our discussion today will revolve around cancer treatment, the importance of early detection, and what other people who are taking care of these patients can do about cancer. Hello, Dr. Apoorva. It's so nice to have you here at TAL Radio today. How are you feeling?
Thank you for having me.
So, we are here to talk about cancer and, how important it is for a lot of people to know the generic probably myths behind it or the importance to know what should be probably specified about it.
Right.
So, what advice would you give to a family or a patient who's come to you who's just detected cancer? And if you can speak a little bit about how important early detection is in the stages.
Feel early detection is everything. It is the key. Okay. Stage 1 cancer is often curable. And curable is a big word when it comes to cancer. Stage 4 cancer is often controllable.
Okay.
Big difference. We like to emphasize on screening and early detection for this reason itself. So I'll give you an example.
Sure.
Recently we picked up a small 1 centimeter breast tumor on a young lady on a screening mammogram.
Okay.
So she had nothing. She just came in for an annual health check. She said that she was the age for the mammogram. So we got her a mammogram and we picked up a small 1 centimeter thing. What did we do? We just excised it, gave a little short course of radiation. She did not even require chemotherapy. She's on some tablets now and she's done. So that is the beauty of getting diagnosed in the early stages, early detection. But unfortunately, what we see in our daily practice is that most of the patients are in locally advanced cancers, stage 3 and stage 4, locally advanced cancers we call.
Okay.
So they are something where we have to see like the pros and cons. We might not be able to offer curative treatments like we would have if the stage was lesser. And then lot of factors come into play. So early detection is the key.
Specify to our audience a little bit about some symptoms we can look out for to detect early cancer, and you can speak about the generic specifications of different cancers as well.
So I think like in simple terms, I don't want to scare that a headache can be a cancer and cough can be a cancer. So simple like headings would be like, there are 3 things which you should not avoid. Okay. If there is any lump, any swelling which does not go away. So it can be in the breast, it can be in the armpit, it can be in the neck, right? So if it is not going away, if it is bothering you, just seek a consult. That is all you have to do. Okay, a breast lump can be a lot of things, but it can also be a cancer. Okay, so you are not the person to decide that. So seek professional help at that point of time. So a lump that does not go away is concerning and it should be seen by a doctor, right? And then there is bleeding, which is not normal.
Okay.
So blood in stools, blood in urine, coughing blood, or postmenopausal bleeding, all of these can be signs of cancer, different types of cancer. So that is also concerning, right? Because I have like a lot of young patients, educated patients, software professionals working, and they say like, okay, PR bleeding, it's maybe I had like too much spicy food, and maybe like I haven't slept in a while. So no, these are things which have to be confirmed by your doctor, right? So these are like little things. It might seem like, yeah, anyone with bleeding is going to come to the doctor, but no, it is not happening. Okay, so that also needs to be kept in mind. And another thing is like change in voice, cough lasting for more than 3 weeks, unexplained weight loss. All of these also could be pointers of cancer, various types of cancers.
Yes, previously you mentioned about team building,
Right.
right? And a lot of people are not asking questions to doctors.
Hmm.
So, as you said, cancer is a long process of
Right.
recovery.
Definitely.
So, how would you tell the audience to educate themselves a little bit? Because it's tough, right? As you said, right now,
Apart from
family also.
professional.
Yeah, apart from professional, in the sense, family also has a bunch of opinions, as you mentioned. So, how
Yes,
would you
yes,
say we
yes.
should educate ourselves about
Correct,
the issue?
correct. So, what I feel is there are set of people who are not aware. They are still untouched by social media.
True.
Right. So that set, they really do not know anything. So whatever the doctor says, it is okay. Or there is a set which is also untouched by social media, but they will believe the neighbor next door more than the doctor. Okay, so these two sets of people have to be dealt with by the professional, I feel, because they are the first hand information givers. Okay, so if the professional has to take out a little bit of extra time
Yeah.
to counsel them and to tell them what it could be till the end, because once you say something, it does not sit very easily, because they're already absorbing such a big diagnosis, and then you say you need this, you need this, you need this, you need this, and then it gets confusing. So
correct.
so the more knowledge they have, the less the fear, right? And then they will not be disturbed by neighbors and other families saying that I got this, I got that. So that has to be dealt. But the population who is into social media, there is a lot of information, extra information out there, and unfortunately most of it might not be true. But the person who is consuming the social media might or might not know that. So that is a little bit tricky thing. But what I would say is look for credibility.
Okay.
Look for credibility of the account or of the channel which you have subscribed to, or and look for credibility of the person who is giving out that. It is very easy to verify, with a lot of information. So you will get around some credible information if you look into it.
Yeah.
So then you think if you want to consume that person's content or not. And then obviously you also have your doctor's treatment orders and instructions as well, right? So if at all you feel that there is something else which needs to be verified, or the doubt needs to be cleared up, take it again up with the professional, right? And as how to help, yes, like support, or like the support system, that yes, you could get your Google Chat GPT help, how to support a cancer patient, what you could do, what you cannot do.
Yeah.
Okay, so things like that, yes. Because if you say it or if you do not say it, people will look for Google and Chat GPT. So it is upon the viewer to ascertain that credibility, and then to know if to consume their content or not in the end.
Okay. I would like to know your statement about if cancer, patients and the number of patients are increasing over the future, and how does recovery and radiation technology look?
Cancer, the number of cases, we do see an increase. Okay, so maybe that is because of awareness, I'm hoping, or maybe because they are getting detected early. More and more people are reaching out these days. Okay, so they're not that unaware. So maybe increase, but there is also a genuine increase in the number of cases of cancer owing to the lifestyle. And
Okay.
there is also an age shift, because earlier cancer used to be like, okay, like 50, 60. That used to be the peak age at which people get cancers. But right now the peak has shifted And it is very, very, very common now in younger population. I'm talking 26, 30, 35. So most of the patients, if you like see the chart, are now around that age group, which is very, very concerning.
Yeah.
And which is majorly because of the lifestyle.
Okay.
The westernization of our lifestyle has led to this age shift in cancers. So young people getting cancers, people getting cancers, all of them have been on an increasing trend recently, and especially with breast cancers and GI cancers in young population, we're seeing them very frequently.
Let's take a pause here before we get to the radiation therapy and the recovery part of it. You right now mentioned about westernization, right? And younger people increasing. If you can talk a little bit about what lifestyle changes could change.
Correct. So everyone knows about it. Nobody wants to do it, but they are gonna hear it from me anyway.
Okay. Yeah, go on, please. This is your seat.
So, tobacco is the biggest no in any form, whatever form, whatever fancy cigarette, vape, or whatever it is. It is tobacco at the end, and a number of other chemicals which are also carcinogens. So, in any form, tobacco is a big no.
Okay.
And then the second driver would be obesity. Okay.
All right.
More and more people being obese these days, again owing to the lifestyle and lack of activity. Okay, driving a lot of breast cancers, uterine cancers, and colon cancers, and many other esophagus. There are like 9 to 10 cancers which are just being driven by obesity. And this is a very new research which has proven and shown that obesity is causing these cancers. Right? So that is also a very common occurrence nowadays. It is basically, obesity is what? Bad food and no activity. Okay, so the kind of foods, the processed foods, ultra processed foods, processed meats.
What about cases like, sorry to interrupt, but what about cases like where obesity happens due to probably family history or hereditary?
Correct. So that is also manageable.
Okay.
Okay, so that is also manageable to a certain extent, but the only factor correlation was seen was obese. So if you are obese, you are at an increased risk of these, whatever the causes.
Okay.
So it might be manageable and it is easily reversible, right, in many of the people. Okay, so I think working towards that is a short way, because now you know that obesity is equally dangerous. They're saying that sitting is the new smoking. That's not me saying it. Okay.
Okay.
So that is how harmful this inactivity is. Because this is a lifestyle. It is our lifestyle. We work on our desks and we go home and then we sit and we watch something. So we are sedentary most of the time. And then what we eat is this, the processed foods, ultra processed foods, junk foods, eating outside. So all of these things are contributing to obesity, which is causing a lot of cancers.
Okay.
Right. So these two are the major things. And then, I think most of modifiable risk factors is tobacco, alcohol. No amount of alcohol is safe as per the new research, because earlier there used to be a cutoff limit for males and females, but that is no longer the case.
Okay.
Each and every drop is harmful. The more you drink, the more the
Risk.
Yeah,
Chances of risk. Yeah.
the risk. So the same thing with alcohol and inactivity, obesity, bad lifestyle, bad food. All of these are the main drivers, I feel, nowadays, lifestyle related things which are happening.
I think that's very important to point out, at least for the youth and the people listening to this podcast right now.
Definitely.
So now let's talk a little bit about the recovery, radiation therapy. As years pass, technology is increasing, but there are a lot of side effects that also do happen because of this long-term treatment. If you can talk a little bit about the pros and the cons, that'd be great.
So people still imagine radiation like it used to be like 20 years ago. Okay, like big machines, hair loss, burns, and you become radioactive in the end. Even till today, I still get questions only regarding this. Okay, so I feel that the major side effect of radiation is like not knowing, the fear of like not knowing anything, and that is the major side effect. Other side effects come later on. This comes in the very beginning. Okay, so radiation treatment, the modern day radiation treatment is not like that.
Okay.
It's like a sniper taking a shot, right? So if your tumor is around like 2 centimeter, 3 centimeter, so what we do is we will shape the radiation beams according to the tumor in 3D. So we have the tumor in 3D on the scans and all. We mark and there's a lot of process. So you have the tumor in 3D.
Yeah.
And then we shape the radiation beams exactly according to that tumor. Then we can see the tumor every day on CT. And then the machine will adjust itself and deliver radiation only to the tumor. So there are very, very, very less side effects than you would imagine for radiation therapy. And of course, the side effects depend on the area being treated and the dose. But most of them are manageable. There can be like some fatigue, weakness during the course of treatment. There can be some skin redness and some, depending on the area being treated, maybe like mouth ulcers or something. But they're not horrific. They are manageable with simple medicines, creams, nutrition, and the prevention, the precautions we ask patients to take during radiation. They're pretty much manageable. And people also often come from their lunch break,
Okay.
get their radiation, go back to work.
Oh.
Yes, so that is how it is. It is pretty manageable. So the fear of not knowing what is inside is, I think, the biggest side effect of radiation.
I think even the word radiation is
radiation
probably
is
like
people think like I am radioactive by the end of radiation. So that is not going to happen.
Yeah.
Okay, so the radiation is only on when you are on the when the patient is on the treatment couch. The radiation beam hits the tumor, and then it's gone. Then it's gone. The moment you come out of the room, you are fine. You can hug your kids right after. Okay, so nothing concerning happens, but whatever happens are temporary. They can be managed very, very well.
Okay. So, right now I feel I'm gauging that we're talking about the stage 2 and 3
No, for
patients
any
or
stage.
okay,
Because
even
for,
stage 4
for
I would
any
say.
stage.
Okay.
Stage 1 patient getting radiation treatment and stage 4 patient getting radiation treatment, more or less the radiation treatment feels the same.
Okay.
Because it feels like nothing. You don't feel the radiation beams on you. Okay, you can't see it, you can't hear it, you can't feel it. It's like getting an X-ray. So when we get an X-ray, do we feel anything? No. Do we become radioactive? No. So it's the same thing. Okay, so for any patient, the radiation treatment experience is the same. The side effects might differ being on depending on the area being treated, but all of the rest remains the same.
Right now you're making it sound quite simplified for us. Thank you very much for that. But going ahead, the next decade or two, how progressive is technology right now for cancer treatments?
AI has already crept into our radiation workflows as
Speak
well.
about that.
Yeah. So I think in the future of any medicine is precision and personalization. So this is what we are already at that. For the most part of it, we are at that. So AI is already in few of our workflows. The radiation planning, it used to take like 2 to 3 days earlier to start the treatment. We need to plan the treatment. So with AI now, it is making our jobs easier a little bit. We can start the treatment sooner because the plan is ready in 15-30 minutes, and then you have to verify and go on about it. So already AI is crept in. Maybe in the future there will be like models, prediction models as to who will get more side effects from the same radiation treatment, because every patient tends to react differently.
Yes.
Patient A might not have anything at all, and patient B for the same dose of radiation is having some side effects. So that can happen. So maybe AI will be able to predict that. Maybe it will be able to predict if the treatment is going to work at the same dose or not. Maybe some patients get cured by this dose. There is a huge database of evidence we have. And as of now, we treat according to that. But the same dose for one person, the tumor might melt. The same dose for the other person, it might melt a little bit, and maybe a little bit of it is still there. Okay, so maybe AI can predict that as well. But apart from that, we are already using adaptive radiation, which is so we see the tumor, right? So the tumor is this, and our radiation area is a little bit around the tumor as well.
All right.
Okay, so if the tumor shrinks, then the radiation field also shrinks. That means lesser side effects. The side effects of radiation is because along with targeting the tumor, there is some amount of normal tissue involved because it is sitting in one of your organs, right? So you shrink the tumor, then we shrink the radiation field. So it is an everyday process. So less and less side effects. There's also a newer form of radiation delivery, the vehicle. It is called proton therapy. Okay, so we do have a few institutes who are doing it. So it is more effective and less toxic than our conventional radiation treatment. So that is also a step into the
What does that
future.
look like? I'm quite interested to
It
know.
looks same like the photon therapy, the dose, everything is the same.
Okay.
But this is more effective radiobiologically
Okay.
and very, very, very less side effects
Hmm.
than compared to the conventional photon. Because in photon, you have like a path where the radiation beam is entering and a path where the radiation beam is leaving. Entry, exit. There are 2 points. With proton, there is only entry point. There is no exit point. The exit point is the tumor. It won't go beyond the tumor at all.
Okay.
So suppose there is this liver and there is a tumor sitting in the middle of the liver.
Yeah.
Right. So conventional beam is going like this. There's not a single beam. There are like hundreds of beams.
Okay.
But yeah. So if the beam is going like this, then with conventional, then it has to come out as well. Then that remnant of liver in the path of the beam also receives some radiation.
Okay.
Right. So now we are doing proton. The proton is coming, hitting the tumor, and that's the end point. No exit dose. So you're saving that much more amount of liver, normal liver. So that is also very, very pleasing. And it is under way. Many trials are going on and it is proven in some cases and different things. But that is also a step into the future.
I think this is great. The amount of technological advancements
Yeah, definitely.
you've spoken to me about, but it also brings me to a question about larger scale to medical access to these new technologies. So how is that going?
That is not going really well at this point of time because of the kind of expenditure involved and the lab because of the expenditure or whatever, the accessibility to such treatments are limited. Okay, especially in a population where most of our people do not have insurance, not aware, and they come from tier 2
Correct.
cities and all. So it is a little bit concerning for that. But photon conventional radiation does the same job at like 1/10 of the cost
Yeah.
with plus or minus a little bit of more side effects. But radiation, conventional radiation is definitely accessible.
Would you
We
say
have
there's a
many
growth to
centers.
the access of health?
Yes,
Okay.
yes. Many new radiation centers have come up, and they have this newer centers have newer machines and resources and equipment. So they are equipped with all of these tumor tracking, flow, and all of these things. Okay, so conventional photon radiation is pretty much accessible,
Okay.
and it's not a limiting factor at all nowadays, because earlier people used to travel and travel and travel for getting radiation treatments. Now you see it everywhere. Okay, that is because of an increasing growth of the radiation units which have been set up all across the country, and newer units with newer equipments, newer features. So that should be good.
Lastly, as I'm going to take a word you said, personalization. Lastly, leaving all the medical sciences and research aside, what message would you give to people who are currently going through cancer treatment or who have just detected, and the people who are taking care of
Correct.
such patients?
Just be aware, trust the process, go slow, ask for support at every point of treatment, whatever it might be. And I think just then leave the rest to God. Okay, because there are things which are not expected. Sometimes unexpected complications do happen, right? And sometimes it goes on pretty smoothly. Even, you might have imagined worse, but then the outcomes are like really surprising. Okay, so all of these things are a part of the process. You have to be in the process for long term. You have to trust the process, trust the doctor, and then just go with the flow.
Okay, thank you so much. It was very nice talking with you today.
Thank
And
you. Thank you, Akash.
thank you for breaking it down and simplifying it for our
Yeah.
audience.
Yeah. Thank
Thank
you
you.
so much.
Thank you.
Thank you for having me.